David was 54 years old. He took his blood pressure medication every single day. He showed up to his annual checkups without fail. His doctor looked at his results and told him his heart looked fine. 2 years later, David was in the emergency room, both legs swollen, struggling to breathe. His heart is barely keeping up with the basic job of pumping blood around his body. There was no dramatic warning, no chest pain, no moment where he thought, something is seriously wrong. He blamed the tiredness on a long week at work. Some swelling in his ankles, he figured, came from standing on a warehouse floor all day. Symptoms so ordinary, so easy to explain away, that nobody, not David, not his doctor, stopped to ask what was actually behind them. I'm going to show you the science, but remember, this video is for educational purposes, and always talk to your doctor before changing your routine. Here is the part that surprises most people the most when they hear it. The problem was never in his heart. His heart was the last thing to show up to a crisis that had been building somewhere else entirely, quietly, for nearly a decade. And the place it started was his kidneys. Now, before you start thinking this doesn't apply to you, I want you to stay with me for the next few minutes. Because this pattern is the one David followed without knowing it is one of the most common and most missed stories in medicine right now. And the reason it keeps getting missed is that we are checking the wrong thing at the wrong time while the clock is already running. Most of us have been taught to think about heart failure as a heart problem. The pump gets old, gets weak, gives out. That is the story. And sometimes that is true. But for an enormous number of people, the heart is not where the story begins. It is where the story ends. And everything that led to that ending started somewhere nobody was paying attention. Here is how I want you to picture this, because once you see it this way, you will not forget it. Think about a car. The engine is running. The dashboard looks completely normal. Nothing is flashing, nothing is beeping, but the parking brake is halfway on. The car still moves, everything still functions, but the engine is working harder than it was ever designed to work, every single mile, every single day. And because there is no warning light for that, nobody notices. Parts start wearing out earlier than they should. The engine starts to struggle in ways that seem unrelated to anything obvious. And eventually, something gives. The engine did not cause the problem. The resistance did. And removing the engine and replacing it does nothing, because the parking brake is still on. In David's body, that parking brake was his kidney's loss of function. Slowly, silently, over the years. Here is what most people do not realize about the kidneys. They are not just filters for waste. Every single minute of every single day, they are managing your fluid levels, regulating your blood pressure, and balancing the chemistry that keeps every organ in your body stable. When they start to struggle, and in the early stages, they struggle with no pain, no signal, nothing you would notice. They trigger a kind of emergency response in the body. The body senses that something is off and starts holding on to extra fluid. Blood vessels begin to tighten. Blood pressure starts to climb, slowly, over months and years, in a way that looks almost normal on any individual reading. And your heart, which had no problem to begin with, now has to push harder with every single beat, against more resistance, every day, for years. That is the parking brake. That is what was happening inside David while his annual checkups came back looking fine. But it does not stop there. As the kidneys gradually lose capacity, they also begin producing less of the signal that tells the body to make red blood cells. Fewer red blood cells mean the blood carries less oxygen per unit. So the heart has to beat faster and work harder just to deliver the same amount of oxygen the body needs to function. At the same time, waste products that healthy kidneys would normally clear start to accumulate in the bloodstream. Those waste products trigger inflammation throughout the body. That inflammation causes something specific to happen in the heart. It causes scarring. The heart muscle slowly stiffens. It becomes less flexible, less able to fill and empty the way it should, less efficient with every passing month. This is not heart disease in the way most people think about it. This is the heart absorbing years of damage caused entirely by something happening somewhere else. The heart is not the source. The heart is the victim. David's ankles had visibly swollen by the evening. He assumed it was from standing all day. He started waking up in the middle of the night to use the bathroom. He figured that was just getting older. Climbing a flight of stairs started leaving him more breathless than it used to. He thought he just needed to get more rest. Each of those things on its own seemed completely explainable. None of them seemed like an emergency. Taken together, they were his body trying to tell him something that nobody around him was trained to hear. By the time those symptoms appeared, his kidneys were already filtering blood at less than 60% of normal capacity. The structural changes in his heart had been accumulating for years, and when his kidneys finally could not keep up with fluid balance anymore, fluid backed up into his lungs, and a heart that had quietly been strained for a decade could not compensate. That was the emergency room visit. That was the moment everything became visible. But the process that led to it had started long before any of that. There is a study involving more than 180,000 patients who were hospitalized for heart failure. 91% of them had measurable kidney impairment. Not some of them, 91%. And yet in most standard care pathways, kidney health is not the first thing anyone checks when the heart starts struggling. It is often not checked at all until things have progressed far beyond what they needed to. And that is the part that matters most for anyone watching this right now. Because this is not inevitable. This is not something that can only be caught after the damage is done. There are two straightforward tests that can detect kidney stress years, sometimes many years before any symptoms appear. The first is a blood test that estimates how efficiently the kidneys are filtering waste. The second is a urine test that looks for a specific protein that leaks through when the kidneys are under strain. That protein can show up in the urine years before kidney function measurably drops. It is one of the earliest signals available. And in most routine checkups, nobody orders it. If you have high blood pressure, if you have diabetes or borderline blood sugar, if you carry extra weight around the middle, or if kidney disease runs in your family, these two tests are genuinely among the most important things you could do this year. Not because they are dramatic, because they are quiet, because they look for what does not announce itself, and because catching it early is where the difference is made. There are medications now that were originally developed to manage blood sugar and diabetes that have since been shown to slow the loss of kidney function, reduce the strain on the heart, and lower the risk of ending up where David ended up. Keeping blood pressure well controlled, reducing salt intake, and keeping blood sugar stable are not just general health advice. They directly interrupt the process described in this video. They act on the parking brake. David is stable now. His kidney disease is being managed for the first time. His heart function, though permanently reduced, has reached a plateau. He is living with both conditions. But here is what stays with me about his story. The earliest signs were already there in his blood work and his urine, years before the emergency room. His blood pressure had been telling a story nobody was reading. The information existed. It simply never got assembled into a picture until the crisis made it impossible to ignore. The heart is often the last organ to raise its hand. By the time it does, it has usually been managing someone else's problem for far longer than anyone realized. Do not wait for the heart to raise its hand. Get the two tests. Ask specifically for the kidney filter test and the urine protein test. If you have any of the risk factors I mentioned, make that the focus of the conversation at your next appointment. Because the window where this is easiest to act on is not after the symptoms. It is right now, while everything still looks fine.